I'm glad you're here with me tonight. We are here to talk about something that I am really passionate about. It's one of my favorite courses to teach at Ashton College as an instructor there and elsewhere. It's medical terminology. It's the language that keeps healthcare running smoothly. And today we're going to explore kind of what that looks like, why it's important, what things you already actually know about as well, which is what I really think is a nice thing when it comes to learning medical terminology, because it can be one of those things that can feel excessive or perhaps daunting or whatever the case may be. I'm going to share my screen with you now and with a PowerPoint presentation that I've created for you. Just one moment while I do that. So here before you is just, as I mentioned, the hidden language of healthcare, as I like to call it. And we'll get through this together over the next 30 minutes or so. And then after I'm done, there'll be opportunities to ask questions. So a little bit about me. I have a bachelor's of nursing. I have a master's of arts in leadership as well. I've spent many years working in healthcare at the bedside for some of those years. Then I moved into healthcare leadership roles kind of soon after that in various settings. So I've been in hospitals, I've been in home care, I've been in public health. I've been in the United States, I've been in Canada doing those kinds of roles. So well equipped to sort of teach this role because in all of those settings, I've been very well teamed up with many unit clerks like the ones that take this program at Ashton as well. For the past 5 years, I got out of healthcare after being a director in public health. And after that, in the last 5 years, I've been working as a professor and instructor at various colleges and various programs. Again, clinical programs like nursing, personal support worker programs, unit clerk programs like this one, health administrative and leadership in healthcare programs as well. But what I love most is helping students build confidence, especially when they're entering the healthcare field for the first time. Not everybody is. Sometimes they change careers within healthcare when they're taking my courses, but I do love the medical terminology. I think arguably it's one of the most empowering skills that my students learn in these variety of these courses. So I'm thrilled to be here to help you with that as well today. Hopefully get you as excited as I am. I'm a little geeked about it, right? So why this topic matters, why medical terminology, it's everywhere in healthcare. It's the foundation of healthcare communication. It's going to be in charts. It's going to be in the orders that we all see as a healthcare team. Reports, diagnostic tests. You probably see it in your own tests or results that come to you or for you when tests are being ordered for you as a member of the public, as a member of somebody that's consuming healthcare. And I hope we'll also see today as well how some of that language is already, again, it's already things that we already know. It's things that we use every day, maybe don't know exactly what all the word parts mean, but we use this terminology quite a bit. It's a safety tool, it's a communication tool. And again, it's incredibly logical when we figure out the variety of ways in which to put things together. And it very much falls in line with things that we have done in our, English in high school and so on, the things that we've already learned. So again, just showing you how you have done and received medical terminology before and understand some of it already and can use that learning, can use that knowledge already to put towards skill, towards understanding other language that you don't know yet as far as the medical terminology goes. Um, what is it? It's again, it's language that's used in every department. It's used in every field. It's used in every location that I've worked and beyond. It's used in the emergency department and it's used in imaging, surgical, medical offices if you're not working in a hospital as a unit clerk, in home care, certainly in public health, anywhere that healthcare is delivered. Unit clerks use it to process orders. They use it to communicate with the clinical staff, the teams that they work with, deal with, again, those orders, diagnoses. A jumping off point sometimes from the unit clerk program is also the health information, the health information professionals, the informatics, and those programs also deal a lot with these symbols, terminology, breakdown of words, and so on when they're doing chart reviews, coding for diagnoses, documentation accuracy, and various things like that. And again, in all the agencies that healthcare touches, this language comes to be. We see this medical terminology over and over again. So if we think about medical terms being built using building blocks like Lego blocks or something like that, or maybe even puzzle pieces, but I've got here this building blocks, these Lego blocks. So once you know the pieces, you can build it. Once you know the pieces, you can break it down so that you can understand the words. And about 95% of the medical terms that we use in healthcare are these decodable terms. There are some that are not, about 5% of them are not, but about 95% of them are these medical terms that can be decoded so we can figure out what these mean, or built if we need to actually build them as well. And again, fun part is you already know some medical terminology. These words here, for example, are words that you've probably already experienced in your life somewhere, if not for you, for somebody that you know. So again, cardiac, hepatitis, hematology, and at some level we know sort of intuitively because we've already had experiences with these words, what they mean. But what do they really mean? How to break them down will help us understand even more words. Again, we use other words often: arthritis, pneumonia, mammogram, intravenous. These are all built words that can be decoded in a variety of ways. So using these, I'll move into some examples of how to carry these out. Again, maybe words that you've already used yourself. So we build words based on the building blocks being prefixes, again, like your English in high school. We know what prefixes are: the root word, the part of the word that gives the word meaning, and then the suffix. So the suffix gives it context, and sometimes the prefix makes a change to that word as well. But we always have that root word, the word that gives the word meaning, a suffix, and sometimes a prefix as well. And sometimes we have a combining vowel. I'm not going to get too much into combining vowels today, but they just make it more easily spoken and referred to. So that's all the combining vowel does. But to use these examples to figure out some words again, so prefixes again. And again, they're part of our everyday language. You already know you have this knowledge coming into our program, coming into our course. So it's not as daunting as it sometimes feels for some people when they come into medical terminology, thinking that it's going to be really difficult. Common language uses it. So the word for, I've got several prefixes here. So internet, for instance, right? We have this internet we talk about every day. We use it every day. We're using it now, right? So it means within. We've got this network that we are within, right? So in terminology, we might see another word like interdental, which would mean pertaining to between or within teeth, right? Somebody's cleaning between the teeth is what that really means. But instead of saying all those words, the dentist cleaned between the teeth, the hygienist cleaned between the teeth, we talk about interdental. Sub, a word that we might use. We don't use it that frequently, but we know what it means. Submarine is a word that we use in everyday English, and sub, part of that word, means, the whole word itself means below or underneath the water. It's below, right? So another word might be substandard, below or less than standard. So if we see a word that uses sub in medical terminology, we can confer that to that language as well, that medical terminology. We've got sublingual, for instance, we often talk about. If you've ever had a medication that you have been told to take sublingually, then we're talking about taking something below, because there's sub there, taking it below the tongue. Maybe we don't know what lingual means, but ultimately we learn that that's what that means when we're told to take medication sublingually underneath our tongue. Subcutaneous might be a word that you might have heard bantered about in the healthcare profession if you have been around it or been a consumer of it. And it means, again, below, the cutaneous level or the skin. Hyper, we use hyper a lot. Hyper, the world, even on its own, we use that prefix. So if somebody's hyper, we know that what that means: hyperactive. That means above, hyper, above, or excessive, or a high, right? And then medical terminology, again, we've probably all heard of, even if we don't experience it ourselves, hypertension. Somebody has hypertension, well, they've got high pressure. That tension is the tension. So they've got high pressure, and we're really talking about high blood pressure in this case, hypertension. We might have heard of hyperthyroidism is a condition, again, of overactive thyroid. So again, you've got that hyper in front. You know that something is excessive, high, more than usual. And again, the opposite then would be hypo, right? So now we've got this hypo, this opposite, this below what we would expect. Hypoventilation or hyperventilation as the opposite, where we're hypoventilating. We've got less than our ventilation that we typically would have. Hypothermia, when somebody is dreadfully cold, right? They've got this pertaining to or condition of this low temperature. Sorry, I've got a dog in the background. Hypoallergenic. We hear about hypoallergenic. We use that in everyday language as well, but it is actually a medical term, right? You've got this hypoallergenic, meaning, you've got this products that are less likely to cause an allergy, an allergic reaction. And then I've got some number prefixes here as well. Very common. We know these things right out of kindergarten, right? We come to the table knowing this when we come into my course. Uni, bi, tri, we know what they mean, right? They mean one, two, and three. I mean, we talk about unicycles, for instance, bicycles, tricycles. We know it means that they've got one wheel, two wheels, or three wheels, right? In terms of medical terminology, then again, moving that over that parallel, we would do unilateral or bilateral. We'll talk about being lateral, being on a side. So lateral means pertaining to a side. So in unilateral terms, we might have somebody might say, you've got unilateral kidney infection. Maybe you've just got a kidney infection on one side. You've got two kidneys. Or if it's affecting both sides, then you've got bilateral kidney infection or kidney disease affecting both kidneys. And then not so much with that. We don't have many organs where we have three. We do have some things, but for regular terminology, again, our bicep and our tricep, right? We talk about our arm muscles, our bicep and our tricep. So those ones just refer to, again, two and three. In that case, those muscles refer to how many points of attachment or points of origin they have in our body. So the bicep has 2 points of origin and the tricep clearly has three, right? But again, recognizing that we use this terminology, these prefixes in everyday language, and they can be converted into and are used in medical terminology all the time. So you come with that level of knowledge already. Again, talking about more terminology now, not just prefixes, because prefixes are only used sometimes. We always have the word root, and we always have a suffix, and sometimes we have a combining vowel if it's needed. So cardiac, for instance. Cardi, once we learn what that means, cardi, again, cardiac, you guys have heard this before, going to a cardiologist or cardiac surgery or whatever that might look like. Cardi actually means heart. Ac at the end of that means pertaining to. We have several suffixes that mean pertaining to, but in this case, we have cardiac. So what do we have? Pertaining to the heart. That's all that means, pertaining to the heart. And every time we see ac now, we've just learned it means pertaining to. Every time you see ac now at the end of a word, you can know that it means pertaining to. Every time you see cardi in a word, you know that word root means heart. So whenever we see cardi, it's going to be referring to the heart. Oh, I mentioned sublingual already again, but now I do have a prefix along with my word root and suffix. So al, again, like ac, is pertaining to. So what do I have here? We already said sub, we know from our English in high school and maybe even before elementary school, is below, right? Low, below. And lingu is tongue. So we do learn new things. We might not have known that lingu meant tongue, but ultimately we do learn it. And then we can put this word together again. So now we've got, and we bring our suffixes to the front, at least what words, what they mean. So here we have a word that means pertaining to, even though it's at the end, pertaining to under the tongue, giving a medication sublingually. Hepatitis is a word that's very common, right? Hepatitis. Itis is very common suffix. Itis always means infection. It's one of those suffixes that once known as one of those student one they remember forever. Itis, regardless of what we're talking about, itis at the end of a word is going to refer to some sort of inflammation of some sort, often an infection as well. But itis in and of itself just means an inflammation of something. So in this case, hepato is the word root, but ultimately hepat means we're talking about the liver. So what do we have? We have inflammation of the liver. Other words, again, itis, you might have heard tonsillitis. Well, we've got an itis. So we've got inflammation of the tonsils. Meningitis, we hear about sometimes on the news, right? What does that mean? Well, once we learn that meningo or meningo is meninges are the layers covering the brain, we know there's inflammation of these layers covering the brain called meninges, so meningitis. So these are some of the words. Nephritis, neph means kidneys. So does renal, but when we have nephritis, we're talking about inflammation of the kidneys. So itis always mean the same thing, and it's not endless, but so on and so on. It's not endless. There are numerous possibilities for itis, though, for sure. So here again, just to show, once we learn one thing, we know what it means regardless of where it shows up. So if once we learn auto here, it's a bit small on your screen, hopefully not too small, but once we learn auto, we know it means the ear. Ophthalmo, it's a big one, but ophthalmo is not an uncommon word. We go to our ophthalmologist, right? An ophthalmologist. Ophthalmo means the eye. Nose, we have a couple. It's naso as well as rhino. You might have heard of rhinoplasty, not unfamiliar when people are getting a nose job, right? So some of these things we come to know, right? And again, hepatitis, we've heard the word before. Now we know why, because hepatitis is talking about our liver. We're talking about an inflammation of the liver. So once we learn the words and their meaning for those word roots, adding on either the prefix and or the suffixes that we learn as well, it's all the same. So we just have to memorize some new words. Some of them, I guess, as I said, we also come knowing. Again, we've heard the word hepatitis many, many times before. What does it mean? Well, now we know hepat means liver, inflammation of the liver. So here again, so gastro, for instance, we can talk about gastro and add on any one of these suffixes and know that it means all of the suffixes mean the same thing, whether we add them to gastro about the stomach, whether we add them to arthro about a joint, and so on. So gastrotomy is going to mean to cut into once we know what tomy means at the end of a word. Plasty means surgical repair. I mentioned already rhinoplasty, surgical repair of the nose. Nose job is what we call it in sort of layman's terms, but ultimately, when we're doing it in medical terminology, we're going to use the right words. We're going to use the medical terms, rhinoplasty, or in this case, gastroplasty. Gastroplasty is going to be surgical repair of the stomach. Logy at the end of anything? We all took biology in school, right? All of us in high school, at least, biology, I think we all had to take or close to it. Biology is the study of, right? Logy here is the study of. So we have, in this case, biology. When I'm talking about biology, we've got the study of life. Bio is life. But in this case, gastro is stomach. So we've got the study of stomach, and so on. So once we know these words, and we do, again, we know many words. We know microscope. We use microscopes in our chemistry classes in high school, right? We know scope, what it is. It's the actual device that we use to visualize things. So we see that if we have an arthroscope, we're using a device. We've got this device specifically looking at our joint in this case, our joints, I suppose. And that's how it kind of all binds together, how we build and then how we break down words to understand what it is that people are talking about, so that we understand them as well and know what to do next. So that's kind of the actual micro lesson of this micro lesson. And we continue to use these. So in practice, we use these, as I said, every day and everywhere in healthcare. Unit clerks use it to transcribe orders. We use it to process diagnostic tests, and we use it to communicate with our teams, no matter, who they are in the teams. I've just got nurses and physicians here, but, the teams are, again, they're kind of endless in a variety of settings, right? From physiotherapists to occupational and respiratory therapists, physicians, nurses, unit clerks, they all make up this large team of individuals to support patient care, right? Patient health care specifically. Why it matters, again, more than ever at this point, it's evolving. Healthcare continues to evolve. It's a fast moving, fast paced environment. Electronic health records continue to increase. They're a staple now, right? When I started teaching this and or when I started doing this decades ago, they weren't as common. Now they are the staple. They are the foundation for care. But it's brought us with increased levels of documentation, more documentation requirements. larger interdisciplinary teams, so more people to communicate with. So that communication has to be crystal clear. It has to be as clear as it can be and as understood by everybody so that everybody knows what to do and keep patient safety first. That's what the whole team must always have in mind, right? So those legal and safety expectations as well. And medical terminology is a foundation for all that. Our programs at Ashton College, the Unit Clerk program is designed to prepare you for the real world healthcare environments. We focus on practical skills, real scenarios come up in our course, terminology that you'll use every day. Myself and all of your other instructors know that we're teaching the right things because we have been in the healthcare setting. We've worked in these places and know that how important all these things are. So it's really embedded in the courses with these supportive instructors. How we design the programs have a lot of flexibility in how they're delivered for you. So it's your decision on how you take these programs. But ultimately, they're going to be designed to do one of two things. You either want to do some live online classes. So typically a class might be a couple of weeks long and 4 hours a day. And it's going to be 3 days a week you're going to be live. Typically Monday, Wednesday, and Friday might be live, and Tuesday, Thursday might be asynchronous where I myself or one of your other instructors is going to do a presentation, but you can watch that at your leisure. So if you're a student who understands what your learning needs are and how you learn best, you might want that live interaction. You want that live interaction with other colleagues, do some work together, ask questions of the professor in real time, and so on. Or you might have need for more flexibility for a variety of reasons. We all live different lives. So there is an option also to have a completely asynchronous course where you watch all of the videos after they've been uploaded each day and every day. Now, you do have to keep in mind that you can't just kind of watch them all at the end. That would be foolish because, of course, we have assignments and quizzes throughout as we go through the course. But again, we've got this interactive learning where we've got both synchronous and asynchronous lessons. For some folks who are okay with it, less synchronous courses can be something that they choose to do, but ultimately keeping you on track, keeping you focused, keeping you having a life outside of the four walls of an institution and so on. And you can access from anywhere. Where graduates work, again, I mentioned them at the beginning as well: hospitals, clinics, long-term care, diagnostic imaging, clinics, public health, areas of public health and in public health, home care, a variety of settings. Roles, they come in all different names essentially, but you've got Unit Clerk, that's what our program is called, is the Unit Clerk program, but you might have heard of other roles out there that you've come across, again, as a consumer or as an employee, perhaps even of healthcare, but registration clerk or a chart review clerk. I've had office assistants, I've had team assistants, I've had a variety of these settings where all of these roles have some fundamental similarities, including obviously the use of medical terminology and the other skills that you're learning in this program so that you can actually transfer them to any of these roles as you move through your career. And finally, just tips on success, really. As you go into this, some of you know the ways in which you learn better, but to practice terminology when it comes up, practicing regularly, repetitive influence can help with fluency, right? Ask questions, stay curious. Stay organized. That's always helpful as well. And of course, accuracy and safety is what we're all working towards when we're working in healthcare. So that's what I say to start doing, even as a student in this program. Thanks so much for joining me today. Medical terminology truly is the sort of language of healthcare. I'm a little bit geeked about it. Not everybody is, but I really do enjoy it. So I hope I make the course very, very fun for the students because I quite like it. I do encourage you to explore the Unit Clerk program. I hope to see you in class. Bye, everyone.